Now we are done with the mental state examination, abbreviated as MSc, and on the basis of this mental state examination, we are moving on towards the cognitive and physical assessment of that person. So basically, when you have totally examined the person mentally, has he been suffering from any delusions, hallucinations, how his thought form is commented upon, can be commented upon, we are basically differentiating the normality from any pathological phenomena that the person may be suffering from. So we've already commented upon the thought form of that person, and then the thought content is also commented upon. What kind of thoughts does he have? Does he have any delusions or illusions or any hallucinations if he's suffering from? Because the patient basically won't tell you directly that he has some sort of delusions or some sort of hallucinations. You will have to basically dig that information out of that particular person. So dealing with that phenomena is again very challenging working as a clinical psychiatrist or as a practicing psychiatrist. Now, when we are done with this mental state examination, we are moving on to the cognitive and the physical assessment of that particular person. In this case, the cognitive assessment, that is basically the thought process of that person, is commented upon. And then we are going to focus on the physical assessment and the investigations that has to be carried out in a particular patient. The urine testing, electrophysiology, and the imaging techniques, they are to be carried out. And all of these investigations are further going to make the base for a particular diagnosis that we're going to stay on or stick on to and manage the patient accordingly. So basically, we are moving towards management of the patient, and that will rely upon all of these assessments and investigations, including the lab investigations and the radiographic investigations are basically coupled upon together to comment upon the cognitive and the physical state of that particular person. Memories tests basically do not indicate the nature of the patient's memory. The appropriate results are basically interpreted in a particular way. The factors influencing the test performance, they're again very important over here. The environmental factors, what kind of environment does he have in his home or at his workplace, or the relationship status or the relationship history is again very important when we are taking the history in that particular patient. The temperature and the noise levels are noted down in the environment of that person. The interruptions, they are noted down in that environment. The time of the day is again very important whenever you are assessing a person. For example, if you just got up after a long sleep, he's going to be fresher, and if he doesn't feel fresher, that means that there is some pathological phenomena going on. He is being depressed or he has a depressive mode on. So the relevant in the mood disorders is again very important, and the patient's physical state you'll comment upon if he's in a state of self-neglect, or if he is in a highly elated state, you'll comment upon these factors as well. If he's in pain or if he's breathless, all of these are commented upon. And then the compliance with the testing is again very important. If he's willful, if he's cooperative, or if he's non-cooperative. The difficulties with the tests when they were being carried out, they are noted down in the history of that particular patient. Now, the testing must include the conscious state. So the Glasgow Coma Scale, the GCS scale, upon that we can comment upon the consciousness of that particular person. Then the language difficulties, if he has some language or the verbal difficulties, then the temporal lobe may be affected. And so we have to basically comment upon what areas, whether it is the Broca's areas, all of these can basically contribute towards the language difficulties in a particular person. Concentration and the attention of the person is again very important. Auditory, verbal, and the learning of the new words. All of these are basically going to comment upon the lobe which is affected in the cerebral hemispheres. So this is very important. If the frontal lobe is affected, he's going to have a slow speech. And if his temporal lobes are affected, he's not going to form a complete speech content. So this is basically going to point out towards the areas that are affected in the cerebral hemispheres. Then the mini mental state examination, which is also known as the MMSE, it's basically a comprehensive form of the mental state examination that we've already gone through. And the delivering results are in a standardized way. Comparison with the normal data is again very important, and the performance is usually influenced by the language, comprehension or expression, and then the executive functions. That is basically the higher functions, the higher intelligence functions, if they're found in that person. The concentration level of that person is commented upon, and the attention span of that person is also commented upon. The assessment of physical health is done in quite detail, and we have to basically distinguish between the physical and the psychiatric problems of that particular person. If he's suffering from some health issues or some physical problems, then there is a risk of basically physical problems as well as psychiatric problems, as they're interrelated. It can be due to the lifestyle factors, the side effects of the medications, the long-term medications that he has been using. And then there is a poor adherence. If there is a poor adherence to the medications that he has been prescribed, then it can also affect the psychiatric evaluation of that particular person. The physical examination, it's basically a comprehensive examination. The sign of such behaviors are noted down. The needle marks, if there is any history of substance abuse, it is then confirmed by the presence of these needle marks. The injection site abscesses are again very important, and they're indicating the substance abuse in that particular person. Then the blood tests are carried out, the tests for urea and electrolytes, the random glucose concentrations in that particular person, and then the full blood count. The thyroid or the LFTs or the liver function tests are looked for. Then we are going to look for the electrolyte imbalances, and that can affect the eating disorders. The syphilis serology is also carried out, and the testing for the HIV is also done. Copper levels to basically distinguish if he is suffering from the Wilson's disease or not. So all of these are going to pinpoint, all of these investigations are going to pinpoint if he's suffering from any physical ailment or not. Checking the prolactin, plasma glucose, lipid profiles in a case of psychiatric medications is very important. When you have prescribed these medications for a long term, you should have a lipid profile, the glucose, plasma levels, and the prolactin levels are done in detail. Urine testing is done by the dipstick. The cases where the urine drug screen can be useful is again very important. Electrophysiology is done by the ECGs and the corrected QT intervals, prolongations, and the electroencephalograms are carried out whenever there is a seizure disorder. Then we are going to move on towards the imaging techniques, for example, the brain imaging to exclude the organic disorders, and then we are going to basically have the functional imaging with the degenerative diseases, for example, the Alzheimer's disease. So the integral part of assessment is the cultural issues. We have to basically inculcate the cultural and the environmental issues as well. Considering the following points is very important. It is basically going to reflect on their own biases or prejudices. Ask if you're not sure about these prejudices and not be intimidated into avoiding the difficult questions. For example, the sexual history of that person. Do not make assumptions and always ask for your clarity, and you can ask again and again as a physician. And you have to ensure the patient's perspective as well. So in this section, basically, we dealt with how are we going to inculcate the cognitive assessment of the person with the physical assessment of that person. So that is the end of this section. Thank you for watching sqadia.com.